Welcome to RWJBarnabas Health's Health Talk Show. I am Dr. Douglas Oshinsky of RWJBarnabas Health Medical Group. The birth of a child is one of life's most wonderful and remarkable experiences. On today's show, we'll learn about the team that is involved in caring for the mother and the baby, programs and educational resources available to families, and what to expect at each stage of childbirth. We are pleased to welcome Dr. Todd Rosen, Director of Maternal Fetal Medicine at Rutgers Robert Wood Johnson Medical School, Karen Garino, Director of Perinatal Services at Robert Wood Johnson University Hospital, Somerset, and Maren Fleur, Director of Perinatal Services at Robert Wood Johnson University Hospital in New Brunswick. Welcome to the show. Thank you all for being here. And for the studio audience as well as the TV audience, can you tell us a little bit about your background? We'll start with Dr. Rosen. Tell us a little bit about yourself and what got you into the maternal fetal medicine program at Rutgers Robert Wood Johnson Medical School.
So I'm Todd Rosen. I'm the Director of Maternal Fetal Medicine for the medical school and for Robert Wood Johnson University Hospital in New Brunswick. I think I started OB just because I had a great experience as a third-year resident. My career path is kind of funny. A former doctor that became the chair at NYU called me up and asked me what I was going to do when I was done with my training. And I said, I don't know. And he said, how about maternal fetal medicine? And I was like, okay, which made my wife a little bit insane because that was 3 years, two more years of getting paid poorly. But it's been the right choice for me. At Rutgers, we get to do a combination of clinical care, which is my main job. But we also do research, and we run a fellowship program to train tomorrow's doctors.
Karen, tell us a little bit about yourself.
Hi, I've been an RN for over 40 years with an extensive background in maternal child health in various hospitals throughout New York and New Jersey. I received my MSN in executive leadership about 3 years ago, and I joined RWJBH 2.5 years ago in the role as the Director of Perinatal Services here at Somerset.
And Maren, you want to tell us a little bit about yourself?
Sure. Good morning, everyone. My name is Maren Fleur. I've been a nurse for approximately 20 years. The majority of my career has been at Robert Wood Johnson Barnabas Health. I started out in a pulmonary med-surg floor at St. Barnabas, which is now Cooperman. But then I did labor and delivery for years at Monmouth Medical Center. I also was a travel nurse for 4 years, so I got to see a lot of different ways to do things at different healthcare facilities. I got my master's in nursing administration, and I have been the director in New Brunswick for about 2.5 years.
Thank you. Thank you all for being here. So we're talking about the maternal fetal medicine as well as pregnancy care. So a woman in this area is now pregnant and is looking at Robert Wood Johnson to deliver the baby. Can you tell us about the types of services that we offer families for delivery?
We offer prenatal breastfeeding and baby care and lactation by our lactation consultants. We are starting to offer tours right now. At the time being, patients can call us and we can schedule a tour when possible.
At Somerset, we currently do have tours. We do schedule tours usually on Thursday evenings by appointment, but we also have birthing basics, prenatal breastfeeding, and baby care classes, which also are scheduled by appointment. And the tours in all of these classes are conducted by our certified lactation consultants who are also former L&D and mother-baby nurses. And at that same time, any patients that have additional questions or concerns, my contact information is provided to those patients, and they can reach out to me at any time with for any additional information they may need.
So very different than when I was younger and we had kids, and basically you didn't visit the hospital. The hospital was there was no birthing center. The woman went into a white room. The husband left the white room. The baby was delivered, and that was about it. And anything prior to the delivery was the Lamaze class, was all that we basically had. And then at the time of discharge, basically, they gave you a piece of paper and they said bye-bye, and you were basically on your own. It was like you had to read the Dr. Spock book and hope that everything, that the baby actually followed the instructions in the Dr. Spock book.
Yes, much different now.
So the fact that you have the prenatal stuff, you have the ability to visit, you have the birthing centers, you have the lactation consultants, and then the follow-up afterwards, very different experience.
Yes, our lactation consultants call every patient, whether they're breastfeeding or not, after they go home, as many times as the patient needs to be followed up. And they make sure that the patients are getting the support they really need.
Now, something that a lot of women are concerned about is pain. You know, if you look in the TV shows, the woman looks like she was just lifting weights, etc., before she was giving birth. You know, she's got that look on her face. What does the labor and delivery care at RWJ University Hospital, both in Somerset, New Brunswick, do with the type of pain management options?
Well, at RWJ New Brunswick, we understand that pain management is not merely a physical sensation, but also encompasses emotional and physiological aspects. So we offer a diverse range of approaches based on whatever the patient requests. We can do IV medication in early labor or epidurals. We also support non-pharmacological interventions. Our nursing staff encourages and supports mobility when possible. We have wireless fetal monitoring. So if a mother does need continuous monitoring, it allows her to walk around a room while we can ensure that we're accurately have fetal surveillance. And we always support doulas for childbirth and pain management.
Another thing that I hear about is that at RWJ University Hospital Somerset, there's an anesthesiologist who's on site 24 hours a day, 7 days a week, which is not available at most of the other community hospitals in the area. Why is this so important, and why is that such a good thing at RWJ University Hospital Somerset?
Well, laboring patients can arrive to the hospital at any time of the day or night. They're not scheduled. So having an anesthesiologist here, one of our priorities is to ensure that the patient has adequate pain management, as we may not be able to alleviate all of their pain, but we certainly do our best to relieve most of their pain. And having the anesthesiologist here 24/7, being able to provide the services to the patient is important. Also, patients that may have had a prior C-section can arrive any time of the day or night in labor also. So they're here if we need to do an emergency C-section. Anesthesia's here so we can make sure we prevent any issues.
Now we're going to go over to Dr. Rosen. Tell us a little bit about C-sections. We hear a lot about them. Tell us why a C-section may be needed versus a regular birth without a C-section.
So cesarean sections are an important part of the care that we deliver to our patients, and they are indicated maybe in about 20% of women having their first baby. We've had a problem in the US and worldwide in that we've been doing far too many cesarean sections, and there's a lot of reasons for that. But through quality initiatives at all of our institutions, we have really lowered our cesarean section rate, and the majority of our hospitals, including Somerset and New Brunswick, have C-section rates that are well within accepted limits. We're really proud of the work that we've done. We've lowered in New Brunswick, our cesarean section rate was somewhere around 35% for the women having their first baby when I started back here more than a decade ago, and now we're below 23%, which is our target goal. Women might need cesarean sections for many reasons. Sometimes the baby is malpresenting, so instead of the head coming down first, it might be breech or sideways. Sometimes the fetal heart rate tracing that we're following shows that the baby's not getting enough oxygen in utero, and that could be another reason. A lot of C-sections are done because a woman's had a prior cesarean section. So one of our major goals is to try to avoid that first cesarean section. There are some women who just can't deliver vaginally because they've had pelvic surgery or because they have big fibroids. So those are benign tumors of the uterus, which are very common in the uterus and sometimes are obstructing the birth canal. There is a wide variety of reasons that women will require C-sections, but we do try to keep those to a minimum. And I'm super proud of the work that all of our institutions, our nurses, our docs, our quality people have done to make sure that we're trying to target those procedures to the women who really need them.
But we're also proud of the fact that what you've done, to reduce the C-section rate, along, of course, with having that anesthesiologist present 24 hours a day. In most cases, there's no complications during childbirth to the baby, but sometimes they may need more care, such as a neonatal intensive care unit. Can you tell us about the neonatal intensive care unit, what it is, why it's needed, and the services it provides at RWJUH Somerset?
Sure. Somerset has what we call a level 2 special care nursery, which is staffed by specially trained RNs to provide care for preterm and sick infants. Any infants born under 32 weeks gestation would be transferred to New Brunswick NICU, but infants born greater than 32 weeks that require additional support will remain at Somerset in the level 2. At Somerset, we're able to provide respiratory support, IV therapy, antibiotics, tube feedings, phototherapy, hypoglycemia treatment, and stabilization for the sick infants that need to go to the NICU at New Brunswick. But our goal is to provide safe care while supporting the family unit.
So as a system, we have both a NICU level 2 at Somerset and a NICU level 3 at New Brunswick.
Correct.
Thus, if the baby born needs further services, we have them available in the system.
Yes.
Which makes our system even better, the fact that we can keep them within the system, plus the fact that if whatever is done at the Somerset, if they need to be transferred to New Brunswick, can easily be sent over with the information from one to another. And since we all are part of EPIC, it's all part of the medical record also.
Yes, it's very streamlined. And another really great thing is that a lot of the neonatologists that are here at Somerset also rotate through New Brunswick. So if the mom is still here, it's nice that they can have contact with the mom while they care for the baby at New Brunswick, and then they may be here at Somerset the next day. They're able to maintain that continuity with the family.
So what kind of cases do you think would require a mother to be transferred from Somerset to New Brunswick or a baby to be transferred?
Well, it would be severe preterm, lower than 32 weeks, we would be transferring over to New Brunswick. A baby that may need specialized care to be on a ventilator, we would keep them here potentially for 48 hours. But if a baby needs really specialized care, would go to New Brunswick. A mom with ruptured membranes or something earlier than 32 weeks would get transferred. Severe hypertension, potential complications would go to New Brunswick.
Have there been any recent ones that you can just discuss without names or anything?
Sure. I mean, Karen gave a lot of good examples. I mean, because we have the level 3 NICU, we're equipped to handle most critically ill newborns, including preterm infants born as early as 22 to 24 weeks gestations and infants with complex medical conditions. To reiterate what Karen said, if you have a mom who ruptures membranes very early on, maybe she's 22, 23, 24 weeks, it would be ideal for her to be here to have her baby delivered here, because our NICU is more equipped to handle the really critically ill newborns and preterm babies.
If I could just add to that, most of our transfers from Somerset to New Brunswick occur during the antenatal period, either the private docs or the patients being seen in the hospital medical offices. We recognize that they have a problem. We have an office that's staffed by Dr. William McMillan at the institution, and so we can identify these problems earlier. It's always better when that transfer occurs during the antepartum period and not emergently. And the one other thing I wanted to add is that we have a full team of pediatric surgeons that can handle a wide array of complications. So one of the reasons that patients will be transferred is if we identify a a congenital anomaly, a birth defect, like a diaphragmatic hernia, or a problem like that would require surgery in the immediate time after a baby is born. Sometimes our babies are born with spina bifida or other problems. And Robert Wood Johnson not only is level 3, but I think we qualify for level 4 status because we have ECMO. We can actually help oxygenate a baby without the use of its lungs. And sometimes we need to do that for the sickest children or the babies with the biggest congenital anomalies. So some of the transfers happen antepartum, and those are the ones I think that Karen and Maren were speaking about. But we also see the majority of transports occur in a less sort of critical time. And that's usually the best way to do it.
Which again is why women who are in this area should really look at RWJ University Hospital, both Somerset, New Brunswick, as the place to deliver their babies, since they will get the gambit of care. Plus, if in case something happens, they have the NICUs, both level 2, 3, and as you said, possibly close to a level 4 with ECMO, that they don't need to be running to other places. They should have it in the local community.
Correct.
Yes.
So tell us about neonatologists. I hear that they're on site 24 hours a day, 7 days a week, also at University Hospital Somerset. Can you tell us what a neonatologist is and why it's so important to have them available?
The neonatologists, they treat infants and preterm babies. They're here 24/7, right on the unit. It's not that they're just in the building, they are right on the unit 24/7, and they are able to provide care to these infants. Whether it's a full-term baby, they see all the babies that are delivered here. They're called for an emergency delivery. They're in the room at the time of delivery if needed, and they're available to provide any type of specialized care for these babies.
And
same in New Brunswick. Yeah.
Yeah, and maybe if I could add, so when in New Brunswick, since we're a regional perinatal center, patients are transferred to us either antepartum or the babies are transferred to us later, because we know that they're high risk. But a problem for a newborn can occur even in a low risk pregnancy. And I don't think, if I was recommending to my wife or a family member, or I guess I'm old enough that when my daughter becomes pregnant, I would not be comfortable with them delivering in a hospital that doesn't have those types of services. Sometimes we have a system-wide huddle every week. Maren and Karen both participate in that. And one of the statistics that we report on is unexpected admissions to the NICU of those children 37 weeks or greater. And at all of our institutions, both the community hospitals and the regional perinatal centers, there's always quite a few babies every week that get that additional level of care. It's usually very short-lived. Maybe the baby needs some help breathing and they might need some support. But without that type of facility available, outcomes might be worse. So it's basically a really nice safety net for our patients. OB is kind of a crazy field. You never know what's going to happen next. Everything could be fine, and all of a sudden it is chaos. We have, again, just a nice system that in these two institutions that we have the personnel in place to make sure that every baby gets the best chance at being healthy. Again,
so important that rather than going to a small community hospital that doesn't have the resources, God forbid something happens. Mm-hmm. At RWJ University Hospital Somerset and New Brunswick, we have the extra available. Hopefully you don't need it, but it's there in case something happens. And as you said, in medicine, you never know what the outcome is until you get to the outcome. And having the backup and support and the availability can mean the difference, between how the person does later on in life. And it also affects, of course, the mental health of the family itself, the fact that it's all available, that they don't have to be transported, across the nation, or they don't have to go from a community hospital in an ambulance to some other place where it's a completely new set of doctors, facilities. It's in a system where there's communication and availability in case something happens.
Correct.
We live in a large metropolitan area. We usually don't have to travel that far, but Somerset and New Brunswick are close. They're within 20 minutes, I think, is the distance. Maybe it's less. And then if a mom is unfortunate enough to have a baby that needs to be transferred from Somerset to New Brunswick, we'll often transfer the mom after that as well. So we really try not to separate mom and baby. So even Karen, like sometimes it's 48 hours and the patients are discharged and then they can spend time with their babies in the NICU in New Brunswick. But more often than not, we just try to get that transfer right away so mom and baby don't have a prolonged period of separation.
So multiple pregnancies, that affects everything. Can you tell us how that's handled at RWJ University Hospital Somerset?
Well, of course, multiples are a bit more challenging than a singleton birth, as we would require additional staff and equipment, and frequently multiples arrive prior to their due dates, and they may require some support in our level 2 nursery. Here at Somerset, we have delivered quite a few sets of twins, but no triplets. And in an emergency, we would successfully care for mom and babies, and we would transfer as needed. Like I said, our level 2 nursery is fully equipped to handle twins, and we've had quite a few sets here. So most of the time they're good, and they go home with mom, but we can accommodate, if we have a level 2 admission and we need to keep them here, and we can accommodate whatever needs the mom may have.
And at the time of discharge, what kind of educational resources, programs do we help provide the family?
In New Brunswick, we offer new mom support programs and breastfeeding support groups. Also, I want to just point out that New Jersey Family Connect is coming soon. Family Connect New Jersey is a free voluntary program offering home visits with specially trained nurses to help support the new parents and the newborn. They'll check on the baby's weight, assess physical and emotional health of both the newborn and parents, provide information on feeding, sleeping, and if there's any available resources.
And can you tell us about the Team Birth New Jersey program?
Sure. Team Birth, it's basically organized, structured huddles between the patient support team and the clinicians. Its approach aims to empower our patients to have a voice in their care and make decisions in the team. As a team, failure in communication has been linked to poor outcomes in the United States. So through Team Birth, we want to improve communication, share decision-making throughout the whole birthing experience.
And we provide that at RWJUH in New Brunswick?
We are actually going live with it in very beginning of April. So our staff is being all educated on it. We have new huddle boards. We're actually kind of implementing it right now, but we haven't officially gone live. It is in collaboration with the New Jersey Quality Institute.
Again, something very important, that the fact that we're still trying to improve ourselves, even though we are great, we're still trying to get even better in the birthing experience.
Correct. Yep. There's always, communication is always a key area where we can improve throughout the United States. So, and patients like to be heard too. A lot of patients feel like they weren't listened to, and we want to make sure that they know we're listening to them, and we want their birth experience to go just the way they want it. Obviously there could be changes if there's an emergency or something, but we always want them to be informed and be the decision makers.
Tough subject is substance abuse and substance abuse disorders during pregnancy. Can you tell us a little bit about that and what we're doing to help?
RWJ has a peer recovery program. It's wonderful. I posted peer recovery information in all the patient rooms. The staff is educated about the program. Anyone can make a reference. So it incorporates multidisciplinary teams we're actively working to eliminate any barriers to postpartum women so they can get the help and support during such a vulnerable time. They'll come to the bedside and they'll initiate support and treatment. On discharge, they also will continue on with the support, and they offer in-person and virtual.
So this is considered the Institute for Prevention and Recovery?
Correct. Mm-hmm.
And so what we're doing is reducing the barriers for access to care for substance abuse. We're helping to see if we can reduce the amount of substance abuse and substance abuse disorders during and after pregnancy in order to reduce complications, as well as, of course, help the mental health of the patient.
Correct.
And the peer recovery program is really unique. RWJBarnabas has made a significant investment in helping to treat patients with substance use disorder in a very non-judgmental and welcoming way. Maren, I'm sorry, you may have said this already, but I think it's worth repeating if you didn't. The peer recovery program is staffed by people with substance use disorder who have more insight into what drives the condition. They can relate to the patients more easily, and we think that leads to greater success and hopefully a sustained recovery. They're available like virtually for all of our outpatient visits. They can do inpatient consultations. They participate at Robert Wood Johnson in New Brunswick in our weekly meetings when we discuss our patients' care in the high-risk group. And they're just a remarkable and wonderful group to work with. And I think they're very well received by patients. It's a tough thing to treat. And we have a lot of patients who, just continue to use and who we don't get through to, but I think we're definitely helping a significantly greater percentage of the patients that we're seeing now than we were before. And there's other system-wide initiatives that will be coming. We hope to become a real center of excellence for the treatment of this disease, which is prevalent nationwide and prevalent in our area.
At Somerset, we also utilize peer recovery, and we have it available, and we do promote it as we need to for our patients.
So again, we have the peer recovery in both University of Somerset as well as in New Brunswick, and all led by our terrific maternal fetal departments. What this shows is, if someone's pregnant in this area, we should really think about using RWJBH as the place to deliver the baby. We've got the prenatal stuff. We've got the ability to deliver in a good, safe environment. We have both a neonatal ICU level 2 and 3 available. We've got terrific support to people. We've got terrific medical assistants, nurses, terrific physicians, physician extenders, so that hopefully that birth process goes as well as possible. We have the Institute for Prevention and Recovery. We've got the Team Birth New Jersey program that's going to be instituted, and we're going to try to become a center of excellence for this. It's everything. Can you, each one of you, we have to conclude the show, but can you give me one last thought about what you think about RWJ University Hospital, both Somerset and New Brunswick?
I could go first. I think we offer amazing services and we prioritize patient safety. And I would want all my loved ones to come here and receive care.
I have to agree with Maren. I feel the same here for Somerset. We have a beautiful facility. We provide safe care. The nurses are all, trained and they love what they do. And it reflects in the care that they give the patients. I receive so many compliments on the care that the patients receive. And I'm very proud to say that, I am the director of this unit and I have excellent staff.
And I guess I would add that most women will do fine in pregnancy, right? Most of our patients, it's a normal physiologic process of being pregnant and childbirth. And we're not trying to scare anybody. There are certainly complications that arise and we're here for them when they do. But it's great to be in this field because most of our patients do really well and we just have to support them emotionally and physically. And I think that they would do well. But it's great to have your baby at an institution that if there is a problem, and these are relatively uncommon, but they're common enough that you want this type of support, whether it's at Somerset or New Brunswick, so that we can increase the odds that both you and your baby will be healthy.
Thank you all for being here. Thank you, Dr. Rosen. Thank you, Karen. Thank you, Maren, for joining us here today.
Thank you.
That concludes today's episode of Health Talk. Please remember that the opinions expressed here today by our medical experts are not a substitute for medical advice from your own physician. If you need a physician, please call 888-724-7123. For more information about maternity services at RWJBarnabas Health, please visit www.rwjbh.org/maternity.